Welcome to Dizzy Therapy. I'm Anthony Veglia, but a lot of patients call me Doc. I'm a doctor of physical therapy who specializes in vestibular rehabilitation, which means that I treat patients with dizziness, imbalance, and vertigo 40 hours every week. Let's talk. Vertigo is not a diagnosis. I'll explain more in a second. But more importantly, I want to explain why the specific words that a patient uses can make a big, big difference. In this specific area, vertigo is a symptom, and very importantly, it is different than dizziness. Vertigo is specifically a false sense of spinning, as in the room is spinning or turning or flipping over, etc. Dizziness, meanwhile, is a much broader term. It's more of a category, including things like feelings of rocking, swaying, tilting, listing, unsteadiness, wooziness, the fear of falling, lightheadedness, and even more. The reason this matters is that as a doctor of physical therapy, or really any other healthcare provider, we need a patient's help to diagnose a patient. You are an advocate for your own health. And telling the best story that you can is crucial to get an accurate diagnosis and to avoid unnecessary tests and time. Time that could be used to get you better. I've actually had, for example, multiple patients that come to me and say, every time I exercise, my chest hurts. Okay, physical therapist, alarms are ringing. Is that angina? Do they have risk factors for a heart attack? Did they recently have cardiac testing? No. What they specifically meant was that they strained their pec muscle, and every time they lift, they're feeling that strain and less strength. Pretty different direction for testing, though technically the same story. Both are worth treating, but pretty different in severity. But back to vestibular topics. Many patients on their first day say, I have had vertigo 24/7 since this started a week ago. Okay, do you have vertigo right now? Oh no, it's never when I'm sitting down, only when I lay down, roll over, or sometimes if I turn my head quickly. Well, see, if a patient was literally feeling vigorous room spinning nearly every hour of every day, they may have something very serious, like a stroke, or a severe case of Meniere's disease, or maybe they're just in the early phases of labyrinthitis. But the more detailed story just sounds like a classic typical case of BPPV, which can be fully treated in one visit. The first story, that sounds like you're going to need potentially hours of testing, which might not be able to be scheduled for a few days. While BPPV, I can test and treat myself pretty darn rapidly within an hour session, and it's gone. So tell me which story you're dealing with. Your story most likely isn't going to be something unusual for a doctor, just statistically, particularly a specialist. So tell us your perspective exactly. Remember, I can't feel what you feel, so help me to help you. Signs are the things I can test for and see myself. Symptoms, only way I know them is if you tell me. There's an old phrase that 85% of a diagnosis just comes from the story. And I could honestly agree with that. Your job is to give me the best information you can, and my job as a doctor of physical therapy is to make sense of that information. Now, that being said, a provider's job is also to ask the right questions to get those answers. So if things are feeling pretty overwhelming, or you're not sure how to explain, or maybe it's just a lot, we're ready for that too. I've had plenty of patients literally take notes, write them down, day by day what they were feeling, so that when they came to me on their first day, they didn't have to explain it too much. They just handed it to me and hey, that worked wonders for helping me to get them better. Trust your providers and give them the info they need to help you. I can never feel what you feel, and you're the only one who feels what you feel. Your friends, your family, they may be right there along with you, but you're the only one who knows exactly what you're dealing with. So get the help you need by helping yourself, by having us help you. Thank you so very much for watching. Always stay curious about these incredible bodies that God has designed for us so well. Leave a question in the comments below because I would love to know what you all want to learn. Subscribe to Dizzy Therapy for more videos in the future. And remember, dizziness, imbalance, and vertigo are never normal. So visit your ENT and vestibular physical therapist as soon as possible so you can get back to moving freely. Have a great rest of your day and may God bless you with stability throughout your dizzy therapy.